Hi, everyone. Welcome to the first episode of Share, the new podcast from Amatus Recovery Centers. I am your host, Kabir Singh. The podcast is certainly a new endeavor for us here at Amatus. We hope that through the episodes of these podcasts, we'll not only educate the general public about recovery-related topics, but help those questioning their substance abuse use and learn more about a life in recovery. This podcast is a production of Amatus Recovery Centers. We are a group of substance abuse treatment centers throughout the country. We offer full continuum of addiction-related care, from medical detox to long-term outpatient and aftercare services. To learn more about our programs, visit amatusrecoverycenters.org or call 888-81-SOBER. 888-81-SOBER. As I said, I'm Kabir Singh. I'm your host here. You'll get to know me pretty well throughout these shows. I've been in recovery for myself a little over 9 years, on my way to 10. I became a certified peer recovery specialist in the state of Maryland in 2013, and that's the topic of our show today. What is a certified peer recovery specialist? How can someone in recovery become one? And what can you do once you become certified? Joining me today is one of my certified peer specialists. He's a fellow of mine in the state of Maryland, Hillu Beyene. He's a CPRS since 2013, right, Hilu? That's 2013?
Yes, 2013.
Excellent. He has an amazing story to share. And here's my conversation with Hilu, and we're going to get started here. So Hilu, tell me a little bit about what a CPRS is, and perhaps after that, how you became one.
Yeah, thanks for having me. It's really good to see you and to have this conversation. CPRS, Certified Peer Recovery Support Specialist. And that is... CPRS is the certification for the state of Maryland that is done through the certification board, Maryland Addiction Professional Certification Board.
Yeah, I think they also they added a behavioral.
The behavioral
health. It's a really long acronym at this point.
And maybe PCB.
Yes.
And so what it is really people with lived experience that are from drug alcohol addiction that have come through to the other side and want to help others as well. And through some professional trainings, additional trainings, along with their lived experience, are certified. When you are certified, you have to go through certain steps, such as 500 hours of training, volunteer hours, actually doing the work, as long as some testing and trainings you have to do. So the CPRS allows you to carry the credentials as a professional credential for the workforce.
Excellent. My understanding as well is there's a state exam here in Maryland as well attached to that. Okay.
Absolutely. The state exam, after you've taken your 45 hours of, there's 45 hours required CEUs in 4 domains. And once you've completed those, and then you've completed 500 hours of volunteer or paid working as a peer and a peer role in an organization, supervised at the same time for about 25 hours of those, then you take the state exam, and then the state exam allows you.
Wonderful. If you could sort of encapsulate with us, how did you become a peer? What brought you to becoming a certified peer specialist?
I'm glad you asked that, because peer is that I am the person in long-term recovery. So for me, the way I came to be about it is that way back in 2011, when I entered my own journey into a new way of life, into recovery, my life changed and saw that it was possible, it can happen, I really felt motivated. At that point, I was informed about a training called Recovery Coach Academy. And what I did when I took that, I didn't know what it was. I just knew that I wanted more information. I wanted more information because I wanted a better life. And then when I took that class, I realized I have something to share, that I can share with somebody in my journey, and how to connect with people at that level, because we do connect with all kinds of other professionals in the process of recovery. But to connect with others in that process. So I became a peer recovery specialist. I started that journey in late 2012, and then 2013 is when I got certified. But it was quite interesting because I learned a lot in that process that I had kind of thought about, and how a peer operates and what it means to be a friend to the person, how to connect to them as a resource and making them feel the resource for
You used a really important word right there. It's the word friend or friendship.
Mm-hmm.
And so that's the interesting thing about being a peer. And maybe you could elaborate a little bit more on that in perhaps in contrast to being a licensed master's level clinician or a bachelor's level clinician, that there are a lot of ethics surrounding what they do. Mm-hmm. They're not allowed it's not condoned ethically to consort with clients after they leave a particular environment of care, or if there's statutes around that don't talk to clients for 2 years after they leave your facility. The peer specialist role, from my understanding, really brings down the walls and the barriers on that.
And that's the beauty of it, because the clinician is such an important part of a recovery process into wellness. But the fact of the matter that there is that ethical consideration, they have the rule of conduct they have in terms of how we connect or how they connect with their clients. For peers, we encountered the participants or their names. They're never a client of mine or a client of ours, because where the connection happens for us is to connect at that friend level. And there's friend and friendly level. There's things I would do for my friends I would not do for my participants, such as I might take my friend, you want to come over, you need to spend the night, or, there may be. But we also, as peers, when we certify, there are a code of conducts and ethics we have to follow. But the connection piece is really important to let them know, I've been where you are, and I come from a place of no judgment. I don't tell you what to do, where to do it, and such. And my understanding and the way we've been working, the friendship part allows a person to let their guard down to connect. You've been where I am, so I'm not the one to judge you, or I'm not the expert on you. I'm your friend, so you're the expert on yourself, so I want to know what I can help you with, and I want to help you. I will ask you, because we tell them that when we encounter, we said, we know you have a clinician, a therapist. If you do, that's great. We love to work. And it's a great team when we work like that. It's a really great team. But allowing the person to say, hey, I'm not a counselor, I'm not a therapist. I'm here to just ask you what you want, what can I help you with. You're the expert on yourself. Let us help you move our obstacles out your way.
How powerful! How powerful! It sounds like a friendship with healthy boundaries. I think a lot of friendships could probably use that. There's some friends of mine that I wouldn't want sleeping over for, let alone a peer or a participant in perhaps in a program that I'm in. So that interesting perspective and light that you shed on that. So thank you for sharing that. Mm-hmm. I understand today in the role that you are, I've actually been able to watch you and stand in the bleachers as you've really excelled in your role here locally in the communities. My understanding is you work in the local county jail system. Can you tell us a little bit more about that? What that peer aspect perhaps brings into that system?
Yeah, yes, absolutely. I do work with the local community health departments, and then I am embedded with the county's detention centers and such, and in a peer role, because they've embraced that in there to help people. So what we have in the system is the engagement is a little different, because we come in there, a lot of people are ready to get out and go home, but where is home? What do I do when I leave here? So the role of a peer in the detention centers, we have about 7 or 8 of us in there for mental health as well as that, and I oversee in that process. And the role in the detention center has really become, because the engagement, the peer starts with a person incarcerated, is about 6 months out before they are released. to start that process, to be able to talk about what are we going to do different, what is it that you want, what kind of environment are you going to, we need treatment, do you want to go to supportive housing, but we support them in that process. And engage them along the way, because the level of stress, because when people detox fast, for example, they come into the detention center, there's a lot of pain, anger, thoughts, processes go. So we meet with them week to week, and just see, build a wellness plan, just have a small, bite-sized plans, even while they're in there, how it may look when we get out, and assign a peer with them that will work with them when they get out, as well as transport them when they get out.
So it's a continued sort of warm handoff once they leave. You sort of hate to put it this way, you have a captive audience, right?
Mm-hmm.
I mean, they are in the jail system, and so you work with them over the period of time they perhaps are incarcerated. After that, do you hand them off to another peer in another program, or do the peers, the 7 or 8 you described, or is there a segment of them that continue on after?
Yes, most of them do continue on outside, but we also have peers that are in the community. So it's called a handoff, a warm handoff, where a peer will take over on the outside and meet with them continually. There is no set time in the community that we work with them. It can be a year. We have had people that we work with for up to a couple of years. Wow. That are independently living now, and it is enough when they say it's enough. It's not when I say it, or when, as a supervisor, I tell them, no, you can't work. There's no such thing as that. It has to be peer-driven or participant-driven, or, it's other-driven, we call it, And so, yes, it's a soft handoff. And if they are from another county, another state or something, we contact the peers, because the peer movement or workforce is pretty much around the country. So we do soft handoffs for them.
I have noticed that as well. That the peer movement itself is expanding rapidly. It's starting to become recognized as within recovery-oriented systems of care as actual evidence-based practice. I mean, we have roles now on assertive community treatment teams. As you know about my history, I happen to have been on an ACT team, as they call them, out in Montgomery County, serving a severe and persistent mental health population. And those are the hardest to reach. And so a peer has a vital role on that particular team that heads out, in this particular case, in a van every day with a psychiatrist, a counselor, vocational, peer, and a variety of other folks. That's excellent. So as a peer here, really integrated quite well. I know that you are here in the region. What are some other roles that you see that peers are doing where they're affecting change?
I think one of the biggest ones that I have seen is our involvement with the police and the EMS and hospitals has been huge. We have peers embedded in the emergency departments. Because it's a very important. Well, so many times when people go to the emergency rooms for addiction or overdose or something,
overdose is
there's a stigma, the stigma and the shame that comes along being back there and such. So we're there to receive them and say, it's okay, we're here. Well, how can we support you?
Can I interject on that one?
Sure.
So a little bit of role play, I guess, real quick. I'm a person in the throes of addiction. I've recently been picked up by EMS for an overdose. I'm on my way to the emergency room. Can you walk me through that? So is a team called? Is a peer already at the hospital, or are they on a mobile team? How does that?
So this is the interesting part. Now, it used to be that EMS will contact us, and or the nurse will say, hey, can you send a peer over? We have somebody in this room. Can you? So we'll dispatch. We have county cars. We'll dispatch immediately to go see that person. Now we have peers actually working, employed. First we had employed by the hospital as peers working in there. So when the overdose survivor comes into the emergency department, they are greeted by the nurse that kind of assesses them and such and says, yes, it's a substance use and all that. And a peer immediately meets with them as soon as they're able to So immediately their first hand is
They're sort of part of the, I guess, if you will, triage process.
triage, part of the triage, and then continues to work with them into after they get the proper care and such, into placing them into treatment, into transitional house, or connect them with the community peer on the outside to support them in that process.
That's awesome. Is the idea there so that perhaps they leave that setting, in this case we're talking about an emergency room, they leave there and go directly into treatment?
Most of the time,
the most desired sort of
most desired. Then again, when we say desired, it's always I want to keep a focus on what they desire. That's my key, because it's not so much what I want, because most of the time when I decide what I want for them, I get in the way of really being that for them, for their buy-in. For them, I need them. So part of the process of the peers being there is in having those conversations. Call it motivational interviewing, but it's really to give self-awareness of what is good for them. You know, you're doing this, but you say you want to do this. So how can I support you in this? What would it look like if you did this or that? So it's not so much what I desire, but my hope is that they desire something they see in their vision. They want a different way of life. If they do, and what that would look like, and I want to support them. Most of the time, that is the case.
That's a wonderful sort of facilitation role and bringing out the best of people. Or you use the word motivational interviewing, and that's certainly one aspect of it. That's we learn more perhaps on the clinical side of what we do as we touch some of that. But yeah, you stirred up this sediment in my mind, and I went back to this slogan when we used to go through these trainings. You and I often find ourselves together. Nothing about me without me. Nothing, and I remember that, and that really encapsulates what you just said. Nothing about me without me. So the inclusion of the recipient of care themselves and really what they want to do. And sometimes I remember it wasn't as simple as, I want to go to treatment. It was, there's aspects to harm reduction and the like. Well, I'm drinking a pint of whiskey every day. I'm really trying to get to just a couple beers, right? And perhaps that may not look like the recovery you or I have, but that's what recovery looks like to them. And we're not here to discount that.
Absolutely.
So tell me how this certification has impacted sort of your own recovery.
It has empowered me personally in my life, because it has allowed me, getting into recovery. My pathway is an abstinence pathway, but I thought that was enough, and it empowered me. But getting certified and really meeting and understanding what it means to meet people where they are, for me as a peer and certified, and being able to provide the service I can, and being able to do, there are 3 pillars as a certified peer recovery specialist we talk about. The pillars, the 3-legged stool, we call them. Right. Phil Valentine's has said that. And that is, we treat people in different ways, as a resource, as an object, or as a recipient. Those are the things. A peer's role is to try to treat people as a resource in that, and asking good questions, and being a good listener, and recognizing my own stuff, and putting out the side to help. So it does allow me, being a peer, certified peer, has allowed me to be in a position that feels I'm making a difference.
Meaningful.
Meaningful.
Yeah.
Yeah, it does.
That's awesome.
Yeah.
What advice would you have to somebody who is either listening to this podcast right now, interested in becoming a certified peer, wants to become a certified peer specialist? Do you have any advice or recommendations you'd want to give anyone?
One thing I want to say is when I first pursued my certification, the only thing I understood about, the one thing I knew that it was always somebody with a lived experience that can be a certified peer recovery specialist. I have come to learn more, and that's what I love about it, is that keep the mind open like a parachute so it can work and be able to get new information, is that if you're thinking you want to be of service, a peer means not just a lived experience. We have family members. If you're a family member, you can be a peer family member. There's a certification for that. What I encourage you to do is that be patient with the process. Jump right in. and go for it, because you lived experience as a family member, which you call an ally, or as an actual person lived through the experience, is a PhD within itself. It's a valuable thing. What I learned is that all the things I used to do were skills, but they were all for the wrong reasons because of the disease. By flipping around the same skills, now you can. So take that and take some of the trainings that are allowed, and they're all over, on the websites and such, and pursue your dream. What I say is that do it for the passion. Most of us get into this for the passion. It is not easy, but it's fulfilling. And be compassionate. Keep compassion in your heart.
Thank you. Well, folks, you heard it here first, and appreciate that, Hilu, for sort of fleshing that out, that it's not exactly required to be a person in recovery. Perhaps you and I are, and that looks the way it does for us. Yeah. But you're not required to be a person in recovery to seek out this. You can be what's an ally in recovery. So you heard it here from our very first guest of our very first podcast, Hillu Beyene. Thank you for joining us today, and we hope to see you soon.
I appreciate having you here. Good to see you again, Kabir, and continue the work you're doing.
Thank you.
Yes.
Hopefully we shed a little light on what it means to be a peer recovery specialist and helped you determine whether or not this is something you want to pursue. After being one for about 8 years now, all I can say it's very rewarding. And you'll have many opportunities to help many individuals in your community who need help. Share is a production of Amatus Recovery Centers. If you or a loved one needs help with addiction or co-occurring mental health disorders, call an admission specialist today at 888-81-SOBER. We hope to see you next time.